Imagine choosing death over homelessness.
Death over homelessness.
That's what one St. Catherine's man is contemplating. Tonight on City News, we
Continue to delve into medically assisted dying and how some believe it is their only option to living in poverty.
Are you afraid to die?
Who isn't? On there.
I'm simply burnt out. All right, that means I'm physically and mentally exhausted.
So why are so many choosing euthanasia over life? I would say the main problem is that we only have a sick care system, not a healthcare system.
Today we're going to be talking about the concept of euthanasia and medical assistance in dying, especially in Canada. It's gotten much worse over the years since it was legalized, and it's I would say it's being used as a way to another way to paper over or conceal the severe limits of the medical system in Canada. Underfunded. Practically no one wants to go into family medicine anymore. They mainly stream to the specialties, less headache there. No one wants to be the front line.
They're hypnotized.
Triage person. And as a result of that and everything else, like the housing costs and everything, and lack of work, lack of training, you name it in Canada, it's just an illusion of what we've been told over the decades. Canada has mainly just been a slave labor central for low wages. That's what it's been. Yeah. Anyway, here's the video we're going to be talking about today. Euthanasia.
imagine choosing death over homelessness. That's what one St. Catherine's man is contemplating. Tonight on City News, we continue to delve into medically assisted dying and how some believe it is their only option to living in poverty. He lives in constant agony due to a back injury, but has started the process for end of life because his rooming house is up for sale and he can't find anywhere else to live that he can afford.
My experience with living in Canada, I grew up there, I was born there. I'm 45, and as long as I remember, since trying to get a job at a grocery store, it's all part-time work. You have to kiss the boss's ass. You have to be a slave for years before they even hire you on full-time. And the housing prices have always been unreasonable. The taxation everything is unreasonable in Canada. So why are so many choosing euthanasia over life? I would say the main problem is that we only have a sick care system, not a healthcare system. We also have misleading politicians who make decisions based on little to no evidence, mainly for votes. You could also say that they lie, but it's not a polite thing to say anymore. You could just say that they offer misleading claims with little to no evidence, often with no evidence, or just they know it's not true.
Dr. Fanwa Mang's clinic is in Mississauga. This sign now greets her patients. She is closing her practice permanently as of May 31st. Dr. Mang has been practicing family medicine for 29 years and had hoped to continue for 10 more, but she just can't do it anymore. It's not the patients that have worn her down, it's the paperwork.
Is this all the admin? It's admin paperwork. I'm showing these doctors what they go through. Just nearly two doctors, but it's very common. My family doctor, any family doctor I've run into has implied that the paperwork's too crazy, and I think that's a big reason why they don't do further testing on people. They didn't do further testing on me. They just don't want the paperwork. If you're not dying in the office, physically dying, they're just not going to do it. They're just going to give you a pill.
Stuff?
Exactly. It's the admin stuff that drowns you.
That admin stuff, it's a huge part of the problem, and it's what's pushing a lot of new medical grads away from family medicine. Because after you put in more than a decade of your life studying and training, at the end of the day, what you want to do is help people.
To a hospital and say, why don't you do a better job? He said, I will. Give me more money. I need more staff, more doctors, more nurses. It doesn't mean a damn. You can give them 10 times as many nurses than doctors. If you have the wrong treatment, they still don't get well. Big Pharma controls medicine today. The system is really sick. And you can quote me literally. I think the system is absolutely sick, and it has to be changed. And I'm not the only one that says that. The province of Ontario said the same thing. The latest Senate committee by Senator Kirby said the same thing. If you read his report, he says it's dysfunctional. What does that mean? He calls the Canadian health system dysfunctional. It means it's sick. So therefore, orthomolecular meant that we would emphasize the use of these natural components to provide treatment on the assumption that in most cases there is something wrong in these different elements.
That's right. Just think about it. Your body's made out of essentially what you eat over a period of months to years. And if you're born with to parents that have epigenetic problems, epigenome is trumps genetics. It's how the genes express themselves, which is very common. Like if your grandmother or great grandmother experienced famine, that affects how you are born, how your parents were born. So these things are not trivial. Look that up, epigenome and great famines.
In 8 to 12 minutes in a conventional model.
And this guy is explaining the difference between functional medicine and conventional medicine. And there's different terms for this, and this is what I couldn't figure out. I didn't know what functional medicine meant. I didn't know functional medicine was basically, or orthomolecular medicine, that that Dr. Hoffer previously that I showed you. That was what founded functional medicine. It's just a fancy buzzword. Everyone's using all kinds of buzzwords these days, often meaningless. But this is essentially how botanists would treat a plant. If we had that for a doctor, that'd be great, but they'd be spending more time in the office with you. They have far more training. Instead of only acute issues, they would be assisting you with metabolic health, especially prevention.
You're saying, I have this, this, and this, and while you're saying that in their mind, they're going down this algorithm that dispenses a pill or dispenses a referral slip to someone else who will give you a pill. From a functional medicine paradigm, our visits are an hour each.
Does my insurance cover that? Yep. Will my insurance cover it? What's my insurance going to pay? What am I going to pay after insurance? Why don't you take insurance? I had somebody say, if you took insurance, you would see a lot more people. Yeah, but I wouldn't be able to help more people. Right. Just because I can see more people doesn't mean I can help more people. You understand? Well, what does he mean? My insurance. Insurance is healthcare. Bull crap, guys. You understand? Insurance is sick care.
Yep.
You understand? Healthcare is sick care. Doctor is disease management care. They just want to take care of whatever disease you have. How can I shut this patient up as quickly as possible so that they can move on and we get them the drugs that they need and they can wait and come back when they need more?
If you had a house plant.
And this doctor is explaining on a simple level what it is. Yeah, very simple, like a botanist would a plant, but medical doctors don't do that. And many people go to different modalities like homeopath and massage therapists. They're increasingly starting to become trained. They are starting to take extra training to become certified in orthomolecular nutrition. But most of them on the base modality that they study and practice, it is not. They, like for instance, you go to a chiropractor, they mainly focus on the spine. Because the mantra of chiropractic is that the spinal misalignments are the cause of all health problems. That's what I saw. That's what I read over the years, and that's what I was told when I went to chiropractors, and that's what all they were focusing on. But they would mention nutrition, but it was very superficial, and they were talking about like the trivial infantile notion of food. Anyway, if you like these videos, please like and subscribe, and better yet, take my free symptom measure tool at the bottom. It's free, no obligation.